Have you ever felt a nagging fatigue that just won't quit, or an itch that no cream seems to soothe? Many of us dismiss these seemingly minor issues, chalking them up to stress, aging, or a busy life. But what if these subtle, overlooked symptoms were actually your body's quiet alarm bells, signaling something more serious beneath the surface? Liver inflammation, or hepatitis, often brings to mind classic signs like yellowing skin or intense abdominal pain. Yet its early warnings can be far more elusive. This article will shine a light on 5 unexpected symptoms of liver inflammation, signs often mistaken for other common issues, and explain why recognizing these quiet signals early could genuinely make a life-saving difference. Number 1. Chronic fatigue. Feeling persistently tired, even after a good night's sleep, is a sensation many of us experience, making it easy to overlook as a serious health concern. Yet, an unexplained and profound weariness can be one of the earliest and most underestimated indicators that your liver might be struggling with inflammation. This isn't just everyday tiredness. It's an overwhelming exhaustion that can impact every aspect of your life, from your ability to focus to your desire to engage in hobbies you once loved. Your liver plays a central role in converting food into energy, a complex process that keeps your entire body running smoothly. When this vital organ is inflamed, its ability to perform these metabolic functions efficiently is severely hampered. It can no longer produce adequate glucose, store glycogen, or process nutrients as effectively, leading to a significant dip in your overall energy levels and a pervasive sense of sluggishness. The challenging part about chronic fatigue is how easily it gets misattributed to so many other common issues. People often blame it on insufficient sleep, high stress levels, dietary imbalances, or simply the natural process of aging. This makes it difficult for individuals and even healthcare providers to connect the dots back to potential liver problems, delaying diagnosis and treatment. Consider the story of a gentleman named Arthur, who, in his late 60s, suddenly found himself too exhausted to tend his beloved garden. He initially thought it was just getting old, or perhaps the aftermath of a particularly stressful family event. It wasn't until other, more overt symptoms emerged much later that his doctor realized his fatigue had been an early, quiet cry for help from his liver. His experience underscores how crucial it is to listen to your body when fatigue becomes a constant, unexplained companion. Recognizing this pervasive tiredness as a potential liver warning sign can prompt earlier investigation, offering the chance for timely intervention. But chronic fatigue isn't the only surprising sign to watch for. Sometimes the clues show up on your skin. Number 2, itchy skin, pruritus. Experiencing persistent, generalized itching without any visible rash can be incredibly frustrating and puzzling, often dismissed as dry skin or an allergic reaction. However, this stubborn itchiness, medically known as pruritus, can be a subtle yet significant indicator of underlying liver inflammation, sometimes appearing long before more familiar symptoms like jaundice make their presence known. It's a symptom that can be relentless, disturbing sleep, and severely impacting quality of life. The biological mechanism behind liver-related itching is fascinating and often involves the accumulation of certain substances within your bloodstream. When the liver is inflamed and not functioning optimally, it struggles to process and eliminate bile salts and other waste products from the body. These substances can then build up, circulating through your system and depositing in nerve endings in the skin, which triggers the intense sensation of itching. It's a direct consequence of the liver's impaired detoxification abilities. One of the most concerning aspects of pruritus linked to liver inflammation is its potential to precede more obvious signs like the yellowing of the skin and eyes that characterizes jaundice. This means the itching could be an early warning signal, occurring at a stage where intervention might be most effective. Many people might try various creams or antihistamines, unaware that the root cause lies deep within their internal organs. If you find yourself experiencing persistent, unexplained itchiness that isn't relieved by typical remedies and lacks an obvious skin condition, it's a strong signal to seek a doctor's advice. Describing the nature of your itching, whether it's worse at night, generalized, and without a rash, can provide valuable clues for your healthcare provider. Discussing this symptom early can pave the way for necessary diagnostic tests and potential early treatment before other, more severe symptoms of liver dysfunction emerge. And while an itch might be subtle, the next unexpected symptom can be even more outwardly alarming. Number 3, easy bruising or bleeding. Discovering unexplained bruises on your body or noticing that minor cuts take an unusually long time to stop bleeding can be unsettling. While many factors can contribute to easy bruising, a struggling liver significantly affects your body's ability to clot blood, making these occurrences a crucial yet often overlooked warning sign of liver inflammation. It's a direct reflection of the liver's profound role in maintaining your body's delicate balance. Your liver is a master chemist, responsible for producing various proteins, including vital clotting factors that are essential for stopping bleeding and forming scabs after an injury. When the liver is inflamed or damaged, its capacity to synthesize these crucial factors diminishes. This impairment means your blood may not clot as efficiently as it should, leading to a tendency for easier bruising from minimal trauma, or prolonged bleeding even from small nicks or scrapes. Real-world examples of this symptom can range from small, unexplained purple patches appearing on your arms or legs to recurrent nosebleeds that are difficult to staunch. Some individuals might also notice their gums bleeding more easily when brushing their teeth, or that bleeding from minor cuts, which would normally stop in a few minutes, continues for an extended period. These seemingly small incidents, when recurring and without a clear cause, can be significant red flags pointing towards a liver issue. It is important to differentiate liver-related bruising from other common causes, such as medications that thin the blood, certain nutritional deficiencies, or aging-related skin fragility. If you are not on blood thinners and notice these changes, especially in conjunction with other subtle symptoms, it is vital to recognize them as potential liver warning signs. Promptly discussing these observations with your healthcare provider can trigger the necessary investigations, allowing for early detection and intervention that can prevent more serious complications. As we continue to uncover these unexpected physical signs, it's also important to remember that liver issues can affect even your mental clarity. Number 4, mental fog and confusion, hepatic encephalopathy. Imagine finding it difficult to concentrate on a conversation, forgetting appointments, or feeling generally muddled and disoriented in your thoughts. These cognitive symptoms, often described as mental fog or confusion, can be deeply distressing and are a serious yet unexpected manifestation of advanced liver inflammation, often referred to as hepatic encephalopathy. This condition ranges from subtle changes in thinking to severe disorientation and even coma, making it a critical symptom to recognize. The underlying mechanism behind these mental changes is the buildup of toxins in the bloodstream that a healthy liver would normally process and eliminate. When the liver is inflamed and its function declines, harmful substances, particularly ammonia, bypass the liver and travel to the brain. These toxins then interfere with normal brain function, affecting neurotransmitters and altering brain chemistry, leading to a wide spectrum of cognitive impairments. Experts often explain how these mental changes subtly creep into daily life. Initially, someone might experience mild forgetfulness, a reduced attention span, or difficulty with complex tasks that were once easy. As the condition progresses, confusion can become more pronounced, impacting judgment and decision-making. Interview excerpts with family members often highlight the gradual changes they observe. A loved one might start losing their way in familiar places, exhibit personality changes, or struggle with basic arithmetic. The potential impact on daily activities and relationships is profound. Simple tasks like managing finances, driving, or engaging in social interactions can become challenging or even dangerous. Relationships can strain as loved ones struggle to understand the source of the cognitive decline. Recognizing these mental shifts as potential signs of liver dysfunction is critical. If you or a loved one notice persistent and unexplained changes in cognitive function, seeking immediate medical attention is paramount for diagnosis and management, which can often reverse or stabilize these symptoms. But the unexpected signs of liver inflammation don't just affect your mind. They can also alter your body's fundamental processes, like appetite and weight. Number 5. Unexplained weight loss or appetite changes. Noticing a sudden, unintentional drop in your weight or a significant change in your eating habits, such as feeling full very quickly after only a few bites, can be alarming. While often attributed to stress, dietary changes, or other common ailments, these symptoms can unexpectedly signal underlying liver inflammation. Your liver plays a pivotal role in digestion and metabolism, and when it's compromised, these functions can go awry, affecting your nutritional status. Liver inflammation can significantly alter how your body processes nutrients. An inflamed liver might not efficiently produce bile, which is essential for digesting fats. This can lead to indigestion, nausea, and a general feeling of discomfort after eating, making food less appealing. Additionally, the liver's impaired ability to metabolize carbohydrates and proteins can contribute to a loss of appetite and a feeling of early satiety, meaning you feel full after eating only a small amount. This metabolic disruption, combined with ongoing inflammation, can culminate in unintentional weight loss, even if your caloric intake seems relatively stable. It's easy to dismiss these changes, perhaps thinking you're just eating less due to stress, or that the weight loss is a welcome side effect of a busy schedule. However, it's crucial to distinguish these changes from those caused by conscious diet efforts or temporary stress. If you find yourself consistently lacking interest in food, feeling full remarkably quickly, or losing weight without actively trying, especially if it's more than a few pounds over a short period, these are significant signals from your body. When these appetite changes and unexplained weight loss persist, it's a clear indication that you should talk to a healthcare provider. They can help evaluate whether these symptoms are linked to liver inflammation or another underlying health condition. Early investigation can lead to timely diagnosis and treatment, which is critical for managing liver health and preventing more severe complications. How liver inflammation is diagnosed. When a doctor suspects liver inflammation, they typically begin with a series of common tests. Blood tests are often the first step, measuring liver enzymes and other markers that can indicate liver damage. Imaging tests, such as ultrasound or MRI, can provide visual details of the liver's size and structure. In some cases, a liver biopsy might be performed, where a small tissue sample is taken for microscopic examination, offering a definitive diagnosis. Early detection through these methods is crucial for effective treatment. Common causes of liver inflammation. Liver inflammation can stem from various sources. Viral infections such as hepatitis A, B, or C are frequent culprits. Exposure to toxins, including excessive alcohol consumption or certain medications, can also damage the liver. Non-alcoholic fatty liver disease, a growing concern often linked to obesity and metabolic syndrome, is another common cause. Less frequently, autoimmune conditions, where the body's immune system attacks its own liver cells, can lead to chronic inflammation. Prevention and when to seek medical help. Maintaining liver health involves several key steps: limiting alcohol, adopting a balanced diet rich in fruits and vegetables, maintaining a healthy weight, and getting vaccinated against hepatitis A and B. It's also vital to use medications responsibly and avoid exposure to environmental toxins. Seek urgent medical care if you experience red flags like persistent jaundice, severe abdominal pain, dark urine, or significant mental confusion, as these symptoms can indicate acute liver failure or severe disease progression. Unexpected symptoms like persistent fatigue, stubborn itching, easy bruising, mental fogginess, or unexplained weight loss may subtly signal underlying liver inflammation. Timely recognition of these often overlooked signs fosters early diagnosis and treatment, which can significantly prevent severe outcomes and support your long-term health. Stay vigilant about subtle changes in your body. Your liver health could profoundly depend on it. If you found these insights useful, please share this article with friends and family. Early awareness truly saves lives. We invite you to subscribe for more valuable health updates, or leave a comment below sharing your experiences or questions about liver health. Let's build a more informed, healthier community together.